Now let's move on to our next session, fifth session, and the focus of the title of this session is Get It Right, Make It Safe. As you know, today we are observing World Patient Safety Day, and the theme of this year's World Patient Safety Day is improving diagnosis for patient safety, and we have slogan also with this day this year, and the slogan is Get It Right, Make It Safe, and this is the title of this program. So it's very important to keep correct or timely और अफोर्डेबल भी, अफोर्डेबल करेक्ट एंड टाइमली डायग्नोसिस जो है वो पेशेंट सेफ्टी में और हेल्थ केयर सेक्टर में पेशेंट्स के लिए, उसकी ट्रस्ट के लिए, उसकी वेलफेयर के लिए बहुत इंपॉर्टेंट रोल प्ले करता है। और पेशेंट सेफ्टी को इंश्योर करने में इसकी बहुत महत्वपूर्ण भूमिका है, क्योंकि हेल्थ आउटकम को भी इम्प्रूव करने में जो डायग्नोसिस है वो बहुत बड़ा एक की रोल प्ले करता है। और बिकॉज ऑफ दैट, बिकॉज डायग्नोसिस इज़ ए की टू एक्सेसिंग द केयर एंड ट्रीटमेंट दे नीड, द पेशेंट्स नीड, और इसीलिए इस सेशन को हम उसी को फोकस कर रहे हैं विद दैट स्लोगन गेट इट राइट, मेक इट सेफ। और इस सेशन को मॉडरेट करने के लिए मैं इनवाइट करना चाह रहा हूँ मिस्टर गौरव लोरिया। मिस्टर गौरव लोरिया, ग्रुप चीफ क्वालिटी ऑफिसर एंड हेड ऑफ ऑपरेशंस एट अपोलो हॉस्पिटल्स, हैज़ over 16 years of experience in the healthcare quality and process improvement, an international surveyor for Joint Commission International. He holds an MBA, Health International Business School, and a Master Black Belt in Six Sigma. May I request Mr. Gaurav Loria to please come on the stage. Oh, you are here. Thank you. Thank you. Please welcome him. So the panelists in the session are Dr. Yashpal Bhatia. I will request Dr. Bhatia to please come on the stage. Dr. Bhatia is Chairman and Managing Director of Venkateshwar Hospital and leader of Astron Group, and has over 30 years of experience in healthcare planning and management. He has established over 50 global healthcare facilities and significantly contributed to quality improvement in India, having served as Chairman of NABH Accreditation Committee. The next in our panel is Ms. Pompi Sridhar. I will request her to be on stage in this session. Ms. Pompi Sridhar, as India Director for MSD for Mothers, Ms. Pompi Sridhar leverages over 2 decades of experience to advance healthcare access. She played a key role in launching India's first health development impact bond, driving quality improvement in the private sector and shaping impactful program for underserved communities. We welcome ma'am in this session. Shekhar Patel ji is the National President-elect of CREDAI, is the CEO and Executive Director and Managing Director of Ganesh Housing Corporation Limited. He is also Chairman of CREDAI Gujarat and holds directorship in multiple companies. Patel has significantly contributed to real estate development in Gujarat and served as the President of the Gujarat Institute of Housing and State Developers. May I request Mr. Shekhar Patel to be on a stage, please. Shekhar ji. And next in our panel is Mr. Atul Garg, who is Director of Delhi Fire Services, has a distinguished career in fire safety, including roles in CISF and numerous honors like the President's Fire Service Medal. He also serves as the Country Director for the International Federation of Fire Chiefs of Asia. Mr. Atul Garg, Director, Delhi Fire Services. Please, sir, please join us on stage. Mr. Sarang Dev is a Professor of Operations Management at ISB and Executive Director at the Max Institute of Healthcare Management, specializing in healthcare operations with the research on vaccine supply chains, HIV treatment, and TB diagnostics. Mr. Sarang Dev, please come and join us on stage. And next in the panel is Dr. Prakash Lal Chandani. I will request Dr. Chandani to be on stage, please. Dr. Prakash Lal Chandani is the President of IMA Dwarka and the State Secretary of the Delhi Medical Association. He has also served as the Secretary of Safdarjung Hospital. Again, I will be requesting Rizwan Saab, our Chairman, and Dr. Atul Mohan Kochar, our CEO, to come on stage and present a plan to all the panelists in this session who are gracing the occasion. And also we will have a group photograph in the very beginning. So let's welcome all the panelists on the stage. So Dr. Yashpal Bhatia, और मिस पॉम्पी श्रीधर, देन शेखर पटेल जी, देन अतुल गर्ग जी, सारंगदेव जी, मिस्टर सारंगदेव, and Dr. Prakash Lalchandani, and the moderator of this session is Mr. Gaurav Loria. So I will request all of you on the panel to have a group photograph with us. Please come forward for the group photograph. और जब ग्रुप फोटोग्राफ हो रही हो तो हम सबकी तरफ से इनका एक साथ वेलकम भी होना चाहिए आपकी ज़ोरदार तालियों के साथ. लेट्स वेलकम them and let's listen to them who are going to talk on a very important topic. Get it right, make it safe. डायग्नोस्टिक्स के सेक्टर को लेकर, एस्पेक्ट को लेकर, हमारे पेशेंट सेफ्टी के सेक्टर में और हेल्थ सेक्टर में. सो नाउ आई विल रिक्वेस्ट श्री गौरव लोरिया टू स्टार्ट द प्रोसीडिंग्स.
Thank you. A very good evening to you all and namaste. I think it's a very important day today, World Patient Safety Day, and thank you NABH for having me here. I do have a very elite panel of highly experienced people who will definitely be great to listen and then understand from them their point of view and perspectives. If you're talking about largely about hospital designs, I think it's not about preventing or saving your hospitals from any kind of disasters or emergencies, but it's about saving your hospitals or preventing your patients from any kind of harm. Hospital inefficiencies, process inefficiencies could just come in because your design is not right. Patient experience could get impacted because your design or your facility is really not built right. Obviously, many of the other disasters could happen, ranging from fire safety to hazardous material, electrical safety related challenges in your facility. Keeping all this in mind and looking at some of these statistics or data points that have been published, for example, that one infection can increase the cost by 1.5 lakhs for a patient. 1 rupee spent wisely could save 16 rupees of costs that you would incur because of bad quality. So some of these data points really help us to push and go through that mindset of understanding that cost of non-quality is way higher than getting that quality at the right time in the right place for your healthcare facilities. So with that, I would like to start with the first round of questions and understanding from these elite panelists sitting here on what do they think about different areas of hospital standards and facilities that could largely improve safety among all the patients as well as staff members who work in healthcare facilities. So first I would like to open it up and pose a first question to Dr. Bhatia, who's been really very experienced in this field. Sir, since you have actually done a lot of projects and you've taken up a lot of initiatives as far as your experience, would really request if you could share some of your experiences regarding what are the key elements of hospital planning that people should look at that generally helps in maintaining or making sure that patients are safe in their facilities.
Thank you, Gaurav. Thanks for this question, and thanks NABH for bringing out this such an important session. We talk of safety, and from where does it start? I think when we talk of safety, we are most of the time talking about the operations part of the safety. But when it starts from the hospital, when you're planning it, how much of safety you are considering at that particular time? I many times ask a question, in fact, when I go to School of Planning, Architecture for my lectures or other places, and the budding architects and others, I ask this question: what are we making? Are we making monumental buildings or are we making hospital buildings? What are we aiming at? To build up beautiful hospitals or good hospitals or safe hospitals? What are we actually working on? An architect delight or a patient and the clinician's delight? Now, these are the questions which have answers to what Gaurav asked me just now. In fact, I have, we have real experts on the panel. We have Mr. Garg, who can talk a lot of fire safety, and others who can talk about infrastructure safety. But ultimately, what are we designing for? We generally say design follows function. And the function is going to give the safety. So if the design is not right, you cannot have the function right, and you cannot have the safety implemented. So it starts from there. We generally talk a lot these days about evidence-based hospital design. While my other panelists will be talking about the specific components, I would be definitely talking about the clinical safety that we want to achieve. A number of hospitals which we visit, I'm sure I have Pawan here with me, who has probably visited a number of hospitals internationally and looked into that. How much of zoning of the hospital is correct? How many places we find it wrong? How many places the theaters have been planned that the infection control practice cannot be implemented properly because of the design faults? So ultimately, I think first and foremost, the evidence-based hospital design as is being accepted as an international norm, that should be kept in mind, and our architect friends, the designers, should feel free to consult these modern principles to make sure that they are implemented in the part. All these accreditation systems that we are talking about, read the language, interpret the language, and see that how the design is going to speak to those languages. We generally, look at the hospital operators, that they haven't been able to do this, they haven't been able to do this, or they haven't been able to do this. But the principle, the first principle, have we followed the evidence-based hospital design? While designing the hospital, keep in mind that we create a hospital, which I go back to my word, a good hospital, a safe hospital, not only a beautiful hospital. It's something like choosing a spouse. You are looking for a spouse who's not only beautiful, but also good and also functionally perfect. So I think perfection is something which we can start at the design stage itself. And these are the principles which are going to help us in doing that. Thank you.
Thank you, sir. My next question would be to Ms. Pompey. Mother and child is always a very specialty, and you have been doing a lot of work in that field. What role do you think partnerships largely play in improving safety standards in healthcare delivery across the ecosystem?
Yeah, thank you to QCI and to NABH for inviting me and to hold this, session, and not only the sessions, but also launch of very critical, phases of accreditation today. And I'm so glad that inclusion of mother and child standards have also been announced. So two parts to the question. First, why collaboration? So, for mixed health systems, where we go to both the private facilities and the public facilities, the government facilities, for our various needs in healthcare, typically have the challenge of fragmented quality, meaning different kinds of services, different quality of services across both the segments and across various hospitals within the private sector or the government. What accreditation does, and what is the whole idea of collaboration, is to ensure one country, one standard, so that no one falls through the gap. And this requires the private sector to step up and collaborate with the government to bring the best of private sector expertise across healthcare, technology, and think of whatever it could be, infrastructure, digitization, all of that, to improve the hospitals, that's rightly said, to make these beautiful hospitals, which I always compare with the nice 7 airbag cars that we all want. However, we know that a single untrained, unlicensed driver who's not following the rules of the road can kill anyone on the road, even with a best car, is exactly what happens in healthcare. And therefore, clinical standards have been released by WHO from time to time, guiding the practitioners or the teams of doctors and ancillary care workers in the hospitals on how to treat patients in this nice hospitals as providing you the best of infection control and patient safety, so to say. So our attempt of this whole collaboration is to ensure we bring together not only the best of knowledge and training, but also the most current through collaboration with professional association, in this case, the Professional Association of OBGYNs, FOXY, being one of the biggest organizations, such organizations in the country, to collaborate with NABH so that every mother and every woman gets that standardized care, irrespective of wherever she chooses to seek care.
Thank you. My next question would be to Mr. Garg. He has got this vast and real extensive experience in fire safety, specifically in healthcare sector, and how to prevent and what has been happening across the world, across India. If you look at some of the data statistics, about 122 deaths that were reported because of fire since 2020 in India. Considering that fire safety is definitely one of the most critical and important pieces, which many a times actually as institutions we may cut corners, we may do shortcuts, while we may have implemented a lot of things when we start a hospital, but in the due course of time we start building departments, we start using our basements, we start blocking fire exits because we need space and we need to expand. I think from that perspective, sir, if you could highlight a little bit on what are the most common fire safety challenges faced by hospitals, and largely how could they be mitigated in our scenarios?
Thank you, sir. My advice to all of you is that, see, all the big hospitals by and large are meeting the requirement. The challenges coming are from the small hospital having a, plot area is 1,000 or 500 square yard. There we are facing the real challenge. And trust me, for all firefighters all over the world, the hospital fire is the most critical fire. And we put most safety in the hospital because, patients are immobilized, they are a heart patient, they are a malady. So taking care of that in case of fire is one of the most difficult tasks. I think the time has come that you should consult us as the time of drawing is office. When you are planning a hospital, you should critically think about the fire safety also, because once the building is constructed, it is not possible for, implement the fire safety requirement at that time. Now all the big hospitals are meeting the requirement, but the issue is coming, I'm facing in a lot of hospitals, not only in Delhi, in all the metropolitan city. Architect has designed the building rightly. Owner has also given, contact rightly. What is happening, the drawing, whatever fire safety arrangement suggested on the drawing has not implemented on the ground. Because the gap between the architect and those who are doing the construction, they have no communication between them, and then because of that, they have constructed, the width has been reduced, the door width has been reduced, corridor width has been reduced. These are the major structural problems which we are facing. All over India, the fire cities are facing. Now I think the time has come that we need a compliance officer who can implement whatever the architect and fire department has suggested to implement in the hospital, which are not being done. The major critical issue in all the hospital we are facing is that structural design. Because that firefighting arrangement is a retrofitting that can be done anytime, even we can improvise them. But what about the width of a staircase? Because the hospital is constructed, you already spent a lot of money. Now, my officer is going, he is saying the width of a staircase is not meeting the requirement. You have to break them, you have to इसको expand. That is a very, very, bad part on us also, and your part also, the architect also, because this is a sheer wastage and also time consuming, because once you have constructed a building, now it is a patchwork. Same is happening in the doorway, same is happening in the corridor. These are the major challenges. And the second challenge is the use of basement. Whatever we are doing in the basement, we don't have a 2 staircases in the basement, or we have blocked the staircases. So these are the challenges all the hospital, all the fire service is facing. I know hospital is a very, very critical, utility for the public, for the all over India as required. But over a period of time, we are forgetting about the fire safety, and we are putting, more concern about how to use the space, because once you started a hospital, slowly it is picking up, you need a more space, you need a more patient. And then where the fire safety is failing. See, most of the fire has occurred due to the COVID period, and the reason is that we have overutilized everything, the machinery, the man, the doctor, and that's why this fire is going to happen. And see, in Gujarat also, in Delhi also, a lot of fire have occurred because of this reason only. So there are two advice from my side, that first, whenever you are building a new hospital, constructing a new hospital, please consult fire department or goods consultant at the dying stage, and see there is a compliance officer or an architect visit regularly to your site, so that there is no construction delay in there. And then you should provide the fire setting arrangement as per the norms, because every city has little bit different, otherwise we are following NBC. And please, train all the staff. Almost all the fire service do not charge any money for training the fire personnel. So you can approach any department and any fire service in India, and please get that trained. Because this is a life safety arrangement, this is a very critical. Fire should not occur, fire is not occurring, but whenever it is occurred, it is a devastating, not only the patient, for a country also, and for us also, and for your patient also. I think that is from my side. Thank you so much.
Thank you, sir, for that enlightening points that people can follow. And actually, one of the research that I was going through, it said that one of the studies which was conducted in a particular state, 80% of those healthcare facilities there never even conducted a fire audit in the last 2 years. So sometimes, when we do a lot of things, I think we forget what are the most critical aspects that we need to look at from building safe facilities. Moving on to fire, I think I'll move to something which is the grassroots, or which is the basic of everything. What we implement always emerges from how we make policies, how we make our plans, how we make our strategies, and how do we implement then based on what we have developed. So I would move to somebody who is a great thinker and a strategist, Professor Sarang. And my question to you is, how can management practices in hospitals be improved to enhance patient safety or enhance safety standards in our hospitals?
Thank you, Gaurav. For a moment, I thought I'm in a wrong panel, because we've got all these safety experts, and what can a management person add to this discussion? And then I realized that in most hospitals, the decision of whether to engage with these safety experts or not is made by management. So that's where things start, and there is a notion that investing in safety may be expensive. So let me first say, key role of management is to reject the false trade-off between cost and safety. There is no trade-off, right? One has to acknowledge that the Hippocratic Oath, it starts from there, first do no harm. So if you're setting up a practice, forget a hospital, if you're setting up a lab, if you're setting up any facility, the question is it designed, as was talked about earlier, to ensure safety? But it's not just the infrastructure design, it's also process design. So do you have processes that guarantee safety? A lot of times we tend to think of safety as being ensured by behavior of individuals. I think it's again a false approach to rely on the goodness of individuals to guarantee safety, because each one of us is prone to making mistakes at times. To err is human, and therefore what is going to be fail-safe are not other human beings, but really very robust processes. To take an example, if you go to an ATM today and you put in your card, it has either one of the two safety mechanisms. Either you have to put in the card and take it out before you can transact, which means the card is in your pocket. Or the other thing is, if you put it in and it goes in, you have to take it out before you get the cash. Again, it ensures that the card is not lost, right? So that's, I mean, there's a Japanese term for it. It's called pokayoki. Now take another example. When you're driving a car, if you don't put on a seat belt, what happens? There is some ding, ding, right? Some alarm, but the car starts, the car moves forward. So that's not an example of good design. You would ideally want the car to not even start unless everyone has put on a seat belt. So I think one of the roles of management is to say, how can I design these processes that ensure safety right up front, rather than waiting for an intervention to happen? That's one. I think the second is to understand that safety will come from habits. So how do we build habits in the organization? You know, you have to keep at it. If people make mistake once, twice, it's very easy to wrap their wrists and say, hey, you know, you made a mistake, right? But how do you keep at it and then slowly, again, many of us would not be wearing seat belts 10, 15 years ago, but then slowly it has become a habit. The moment we are in the seat, we are clicking the seat belt. So just allow for that patience, keep at it, and slowly people will change their behavior. Thank you.
Thank you, Professor. While we are sitting in Delhi, I think we always look up to Delhi being the center as well, to learn a lot of things from here and see what we could further implement. So my next question would be to Dr. Prakash. How do regulatory frameworks influence hospital safety standards in Delhi, just to figure out what all can we learn from this framework which is utilized here?
Thank you, Gaurav. Warm greetings from the Delhi Medical Association and the Indian Medical Association headquarters. We represent a big segment of medical establishments and doctors, starting from the standalone clinics to the corporates. Now, basically, as a basic nature, doctors don't like regulations. But regulations are part of the law of the land, so we have learned to live with them. And slowly now we are part of those, we are observing those regulations as a matter of day-to-day licensing and accreditations also. So certainly the healthcare regulatory mechanisms play a pivotal role in ensuring the quality and the patient safety standards by mainly three systems: legal framework, guidelines, and enforcement mechanisms. In Delhi, primarily the licensing mechanism is through the Delhi Nursing Home Registration Act, which is the only licensing authority, which gives the license for the nursing homes to operate. These licenses, they provide an ecosystem for infrastructure, human resources, sanitation, and various other healthcare standards. Voluntary bodies like NABH motivate us to adopt the global best practices. So these are about the licensing and the legal framework. Various guidelines, there's a long list, standard treatment protocols for reducing the medical errors and providing the consistent and quality health care. Time to time, audit and audit inspection, internal audit and external audit have also been grown to be very successful in giving us the insight. Patient safety regulations include the robust infection control systems and the waste management protocols. Periodic maintenance of an audit of the medical equipment also helps in maintaining the patient safety quotient. Staff training is again a very big issue in maintaining the patient safety standards. Older staff and the onboarding of the new staff both involve involvement of the lot of education and awareness for the the healthcare workers. And it should always be done with a periodic upgradation of their what we call knowledge and the skill base. I must say, all the medical establishments from the clinics to the corporate hospitals must follow the fire and other law of the land, because they are the actual problem which is happening in these days. Fire NOC, fire norms basically, I must say, not fire NOC, because all the establishments don't require fire NOC. Whether fire norms for the clinics is a self-audit, third-party audit, or the fire NOC, whichever is required must be done by the medical establishments. Health information reporting and the disaster or the adverse outcome should be reported. Patient rights is another very important sector where the patients and their attendants play a crucial role. Inform hospital should give them the right of informed consent, privacy, and the quality care. In case of any alleged medical negligence, we have a redressal for the patients in form of medical councils and the Consumer Protection Act. All these things put together give us a robust framework for the healthcare standards and the quality and the patient safety mechanisms. And in Delhi, we follow all these things as a matter of rule. Thank you so much.
Thank you, sir. I think I really picked up 3 points largely from what you said on focusing on legal frameworks, guidelines, and enforcement mechanisms. I think these are the most critical things that you very well articulated and highlighted in this talk. I'll go back to Dr. Bhatia again on giving a simple message to all the audience here on, if you have to very briefly define what are the 2 strategy pointers people should keep in mind when they are building a facility or renovating a facility, what would that be?
Okay. Thank you, Gaurav. I think having been part of more than 65 healthcare institutions, which I have been part of design, and more than 400 hospitals where from accreditation or quality point of view I've been associated, there are few fundamentals which we forget. The first, and we always talk, design follows function. So first thing is the functional brief. The functional brief clarity and anonymity on that is something which is the most important. I went to one of the AIMS projects and they say कि ये building बनाना है, अब इसमें क्या adjust करना है आप देख लो. Most of the times the buildings are being designed by the architects or the designers or the planners, and the hospital healthcare people are required to fit in the requirements into that, which probably is the most inappropriate thing to happen. Now that is resulting into the next part, that the proper zoning is missing. Zoning of the hospital by itself and zoning of each department, whether it's the CSSD or whether it's a kitchen or whether it's operation theaters or whether it's a biomedical, impacting the overall traffic. So all the traffics, the traffic of the patients, the traffic of the attendants, the traffic of the clinicians, the traffic of the material, the traffic for the food, the traffic for biomedical waste. So when this zoning hasn't been taken into account, that's the impact which actually is felt later on in the operations. The third thing is the guidelines, the regulatory guidelines, the compliance requirements, whether they are from the AERB, whether they are from the ASHRAE, they all are meant to be studied and interpreted and implemented in the environment in which we are creating the Indian hospitals. Not to forget the economic part of it, not to forget the Indian economic system, not to forget the paying system, but at the same time, all those principles and the guidelines, they have to be implemented. You don't do it today, tomorrow you can't say, I have a safe hospital. And last, again, I say, I think the key is involve the people who are going to use the hospital. Ultimately, the user is the one who knows what they needed. And at the end of the day, 20% of the hospital buildings are remodeled to shape them to the user's requirement after they have been built. Compromising the principles, compromising what has been planned for, compromising what has been designed for. So if we keep these in mind, and of course, I repeat, evidence-based hospital design is a very good guideline coming globally. We should be able to customize to our Indian requirements and implement them involvement in the hospital planning systems. Thank you. Thank you, Gaurav.
Thank you, sir. A similar question to you, Ms. Sridhar, as well. A simple and a quick message for the audience on building safe facilities for mother and child.
Yeah, in fact, I would elevate it to keep it at a one country, one standard. I think the strength is in being together, in making the movement the single largest movement anywhere in the world, as we do for most things in India. And that will heavily depend on every one of you in the room as well as collaboration. And I really look forward to collaborating going forward. Thank you.
Thank you. The next quick message from Mr. Garg on specific any 2 pointers how to make fire safe facilities.
See, safety start from the table and then it goes to the field. तो मेरा सबसे यही एडवाइस है कि whenever you are constructing a hospital, a small or big one, please consult fire department, fire consultants since beginning, and see these are implemented on the ground. That is the only way out. Otherwise, there is a problem. And whenever you know there is a fire, it's a bad name for the country also. We have a world-class medical facility, but hospitals are not safe. These are the questions being posed to me by whenever there is a fire from the world over, Voice of America, New York Times. How, Mr. Garg, you are saying you are in a capital city and the hospitals are not safe? How you are, how they are doing business, how they are being allowed? So these are the questions we are facing, really a tough task for all the fire department. So my request is that please consult us before you are thinking of constructing a hospital, building a hospital. Please start with us very, once you have started making a trying, please consult us. Or one more thing I would like to inform you that so far in Delhi, the building which has been designed in consultation with the DFS, there is no fire in last 20 years. Not a single death, no fire in almost all the building which has been designed and consulted by DFS. So that is the, beauty of designing part of it. If you
I think this really deserves a round of applause.
Thank you so much.
Thank you, sir. I really don't know how many of us actually do that, before you start building or designing a facility, you take into consideration or inputs from fire. It's always like, you do it, you're ready for launch, apply for the license, and then you make changes, whatever are suggested for you to start the hospital. So I think that was a great and a very relevant point. Thank you for that. Professor Sarang, moving on to you, what would be your quick message to the audience on what role exactly leadership plays in improving the culture of safety within healthcare organizations largely?
Yeah, so I'll say a very long term. It seems complicated, but I'll say it anyway. It's called psychological safety environment. So it's not just patient safety, psychological safety. What it really means is there a culture in the organization, if a frontline worker was to come up and tell a leader, I've made a mistake, that there has been a near miss, or that there is a sentinel event, how do you respond as a leader? Right? That shapes the culture, as Gaurav is pointing out, because that either encourages or discourages people to bring out problems. No problem can ever be solved unless it's brought out. And I don't know of any single organization where mistakes are not made. It's important for the leaders to find out as soon as the mistakes are made. And that can happen only through this safe psychological environment. That's one. I think I'll stop at that because in the interest of time.
Sure, I think yeah, it's very important. A lot of times we missed on the psychology part of it, though we do a lot of other things that we work out on and implement, but yes, that was really very critical, and thank you for sharing that. And my last question for today would be for Dr. Prakash on what recommendations would you make to largely enhance compliance with safety regulations in hospitals?
इससे पहले कि मैं इसका आंसर दूं, I must compliment the team NABH headed by Mr. Shah, Dr. Atul and Dr. Mr. Rizwan, for making quality and patient safety a buzzword all across India, from Kutch to Guwahati, from Kashmir to Kanyakumari. My full compliments to you. Mere first few comments and observation from my side would be as a State Secretary, Delhi Medical Association, and a medico-social activist. Patient safety is paramount, no doubt about that. But at the same time, healthcare delivery should be equitable and affordable also. There has to be a balance between the two. Health is one such subject where 100% of the population has an interaction with the medical system and the medical professions. With all due credit to the government and the corporate hospitals, I personally think the majority of the healthcare delivery is still being done by the neighborhood clinics and the smaller nursing homes, which are operating in the various tier 1, tier 2, tier 3 cities, in either the authorized areas or the unauthorized areas also. As far as Delhi is concerned, master plan mandates opening up of and the operational situations for the nursing homes. My appeal to all lawmakers, policy makers and enforcing agencies to discuss and deliberate with all stakeholders before making such laws and taking the ground level situation in account. This will really help in compliance of the laws and it will be better looked after. My second point is specifically for the Delhi Nursing Home Registration Act. We personally feel, as a Delhi Medical Association, we have been talking to the Directorate of Health Services very often on this. It has to be simplified. There has to be a single window system for applying the registration. The registration has to be at least for the 5 years, and the preferred mode of application should be the online mode rather than the physical mode, because it opens up to the human interaction and then the form of corruption creeps in. And if you go by the Delhi Nursing Home Registration Act, there are requirements about the manpower requirements also. Everyone knows there is a availability crunch as far as the qualified RMOs and the qualified nurses and the paramedics are concerned. So that has to be kept in mind before we go for such strict laws and strict requirements or guidelines. Another reason for concern is the biomedical waste and the solid waste, which solid waste is a recent incorporation in the requirements. So all these things have to be deliberated and dealt upon. I think these are the practical problems in the Delhi Nursing Home Registration Act and which have to be sorted and discussed. Now, the most important thing and discussed is the fire. Atul Sahab is sitting here. We have met in the various meetings. So much has been talked about the fire incidences in the recent past. There is no doubt all medical establishments have to follow the fire norms, as I have already said. Self-audit, third-party audit, fire NOCs, they have become the buzzwords. Honorable Court has already given its observation and DMA has already requested the DFS, Delhi Fire Service, to give us the norms and the norms for the various categories of the medical establishments. But my one request to Atul Sahab is, please give us the guidelines which are practical, doable, implementable. There has to be a distinction between the prospective guidelines and the guidelines for the buildings which are older and which are already under operations. Because majority of the older buildings doesn't have that kind of a civil infrastructure which are given in the DFS guidelines. Either they have to be shut down or they have to be brought down, the entire building has to be brought down. My request to Gaurav Sahab is, please allow them with the retrofitted fire safety installations for the older buildings, and all the civil infrastructure guidelines have to be for the prospective buildings which are made new and after a certain cut-off date. That would be a big help, sir. My third request, I'll take 30 seconds more. My third request, and a very important request, which is very unusual also, to all the landowning agencies, various builders, and the CREDI. The representative of CREDI is not here because I certainly wanted to meet them, to earmark certain percentage of commercial establishments in their projects for the healthcare sector. Not only for the corporates, but for the smaller clinics and nursing homes also. So many of you are sitting here from Delhi. When you have seen a particular site has been given by the DDA to the clinic or the smaller nursing homes, you have heard about the corporate hospitals, but no, not a plot or a shop for the clinic or a smaller nursing home. This is a very, very big lacuna in their town planning and country planning departments. For a smaller issue, for health issues, nobody goes to the corporate hospital. They would prefer to go to the smaller clinics and the smaller nursing homes. I think this is a big lacuna which must be filled up. I have given my representations to the DDA as well as the Haryana government also as a NCR region, and let us see how the things come up in the future. Rest of the things are already being discussed by the various healthcare administrators here, like involvement of the top management is key thing, because the quality percolates from the top to bottom. The patient safety and the quality is one thing which is imbibed by from top to the lower staff. It has to be done. Staff training and education is again a very important feature. Standardized communication protocols and incident reporting system, as Professor Sarang has already talked about. Sentinel reporting system. This kind of a sentinel reporting has to be non-punitive, and it has to be really taken into that kind of a confidence where the root cause analysis and so that the future occurrences can be avoided. Involvement of technology like electronic health records, barcoding and RFIDs have to be done to reduce the medical errors. Again, the periodic audits and the risk assessments play an important role. Infection control, sterilization and isolation protocols, they are already there in place. And lastly, clear-cut plans for the emergency and the natural disasters. But I still feel my first 3 points do carry a weight. First is involvement of the doctors as well as the medical associations into the law-making process. Second is simplification of nursing home registrations all across India, especially in Delhi. And third is request to the fire department for making a practical and implementable guidelines. And fourth is appeal to all the landowning agencies to take care of needs of the healthcare of the society, from the clinics to the corporates. Thank you so much.
Thank you, Dr. Prakash. So we heard logical comments, we heard initiatives, we heard some of the data points. I think all of these lead to one conclusion, that safety is just not a checklist, it's a culture. It doesn't happen by chance, it happens by choice. And that is what all of us need to carry back the mission from this conference back today, so that we could implement it in our locations, in our healthcare ecosystems, so that all our patients, all our members who work with us as healthcare professionals and the community is safe at a larger extent. Thank you so much, all of you, for your patient listening, and I would also like to thank all the panelists here for this session. Thank you.
Thank you so much, Mr. Gaurav and all the panelists. मैं रिक्वेस्ट करूंगा डॉक्टर अतुल मोहन कोचर जी और रिजवान साहब वंस अगेन प्लीज़ कम ऑन स्टेज, और सभी को मोमेंटम हिट करके उनका थैंक्स हम अपनी तरफ से करेंगे, क्योंकि स्ट्रक्चर्स को, इंफ्रास्ट्रक्चर्स को सेफ रखना और सेफ उसको मेंटेन ऑपरेट करना ये बहुत ज़रूरी है। और इसीलिए सेफ हॉस्पिटल्स अपने आप में इस सेक्टर में जब हम आगे बढ़ रहे हैं पेशेंट सेफ्टी को लेकर तो बहुत इंपॉर्टेंट रोल प्ले करता है। और इसके लिए सभी पैनलिस्ट का जो इसमें शामिल रहे, डॉक्टर वाई भाटिया साहब, चेयरमैन एंड एमडी Astron इंस्टीट्यूट ऑफ इंटरनेशनल स्टडीज़, चेयरमैन एडवाइजरी काउंसिल वेंकटेश्वर हॉस्पिटल द्वारिका, उनका बहुत बहुत थैंक्स। इसके अलावा श्रीमती मोम्पी श्रीधर, डायरेक्टर इंडिया MSD फॉर मदर्स, उनका भी थैंक्स इस सेशन में शामिल होने के लिए। एंड वी ऑल्सो हैड इन दिस सेशन श्री अतुल गर्ग साहब, डायरेक्टर दिल्ली फायर सर्विसेज, श्री सारंग देव, प्रोफेसर ISP हैदराबाद, एंड डॉक्टर प्रकाश लाल चंदानी, वो इज स्टेट सेक्रेटरी दिल्ली मेडिकल एसोसिएशन एंड जॉइंट सेक्रेटरी नेशनल IMA। इन सभी का जिन्होंने अपने एक्सपीरियंसेस से और जिन्होंने अपनी जो फील्ड की एक्सपर्टीज़ है उसके माध्यम से हमको फ्यूचर में सेफ हॉस्पिटल्स को किस तरह से बनाना है, ऑपरेट करना है, उसको रन करना है, उस दिशा में बहुत इंपॉर्टेंट कुछ एस्पेक्ट्स हमारे सामने रखे हैं जो हमारे लिए गाइडलाइंस की तरह काम करेंगे। तो इन सब का बहुत बहुत थैंक्स, बहुत बहुत आभार। एक मेमेंटो के साथ और एक फ़ोटो फ्रेम के साथ हम इन सब का थैंक्स करना चाह रहे हैं। और इसमें सेशन को जिन्होंने मॉडरेट किया, श्री गौरव लोरिया, ग्रुप चीफ क्वालिटी ऑफिसर एंड ग्रुप हेड ऑपरेशंस SVP अपोलो हॉस्पिटल्स, इन सब का हम बहुत बहुत थैंक्स करना चाहते हैं हमारा इस 5th सेशन में जिन्होंने हिस्सा लिया और अपनी बात आपके साथ शेयर की इस सेशन में। NABH पेशेंट सेफ्टी कॉन्फ्रेंस NPSC 2024 के इस सेशन को यहीं कंक्लूड करते हुए हम अपने नेक्स्ट सेशन की तरफ आगे बढ़ते हैं। एंड द नेक्स्ट सेशन इज emerging ABDM and NHCX opportunity for private hospitals, ladies and gentlemen.